video from Medicise. So this video will be introducing our general surgery series. So this video will highlight the general surgical conditions that we will be covering throughout this series and common surgical procedures to be aware of. Now, a good way to split up general surgical conditions, particularly for revision purposes, is by categorizing them into 9 quadrants. So let's imagine that this is the diagram of the abdomen. So the upper abdomen consists of the right upper quadrant, the epigastrium, and the left upper quadrant. Then the middle part of the abdomen, where the umbilicus is, consists of the right flank, periumbilical region, which just means around the umbilicus, and the left flank. The lower abdomen consists of the right lower quadrant, also known as the right iliac fossa, suprapubic area, and the left lower quadrant, also known as the left iliac fossa. Now, I know that this looks like a lot of conditions to remember, but let's take each segment separately. So let's start off with the right upper quadrant of the abdomen. So a good way to remember these conditions is by knowing the anatomy and what organs can be found in that area. So in the right upper quadrant of the abdomen, organs that are present include the liver and the gallbladder. Commonly, when patients present with right upper quadrant pain, you can get problems to do with the gallbladder. So this includes biliary colic, cholecystitis, and cholangitis. Now, if we move on across to the epigastrium, the upper middle part of the abdomen, the organ that's found in this area is the pancreas. So an important condition to remember is pancreatitis and pancreatic cancer. But also it's important to remember that the gallbladder can extend from the right upper quadrant into the epigastrium area. So you might get symptoms of cholecystitis and cholangitis being presented as epigastric pain. Now, in the left upper quadrant, you can find the spleen. Now, we won't be going into any conditions to do with the spleen, but it's also important to know that the pancreas can also extend into the left upper quadrant. So again, important to rule out pancreatitis and pancreatic cancers if patients present with left upper quadrant pain. So then we have the right flank and the left flank. So that's in the middle part of the abdomen, right about where your waist is. Now, the organ that's found here are the kidneys. Now, this will be covered in our urology series. But in terms of general surgery conditions, a common condition that we can find across the middle part of the abdomen is mesenteric ischemia, which is reduced blood flow to the large or the small intestines. Now, in the centre part of the abdomen, in addition to mesenteric ischemia, you can also get early appendicitis. Now, although the appendix is located in the right lower quadrant of the abdomen, early signs of appendicitis can start in the centre of the abdomen, then migrate towards the right lower quadrant. How the organs that's located in the centre of the abdomen is your bowel, so your small intestines and your large intestines. So bowel obstruction can occur, presenting with generalised central abdominal pain. Now, if we go lower down, I've already mentioned in the right lower quadrant that you can find the appendix, so appendicitis can occur. Now, other conditions that can occur include hernias and diverticulitis, and that's because the colon can be found in the right lower quadrant. Suprapubic, so the organ that's found suprapubic is the bladder. So conditions related to the bladder will be common. So conditions related to the bladder will again be covered in our urology series. However, for general surgery, the pain from the appendicitis can be felt suprapubically as well. Now, in the left lower quadrant, again, bowel can be found. So diverticulitis and hernia are again are common in these areas. So that may seem like a lot of topics that we're going to cover, but quite a few of the conditions can be spread over multiple regions of the abdomen. And we'll be going through these topics in a lot more detail throughout these series. So other conditions that we'll be covering include anorectal conditions, such as hemorrhoids, anal fissures, perianal abscesses, and anal fistulas. We will also be covering the following malignancies: pancreatic cancer, colorectal cancer, and anal cancer. Now, if there are other conditions that you would like to be covered in the series, then drop a comment below and we will try and make sure that it's covered. Now let's move on to the common procedures that can occur in general surgery. So if you're on your placement at the moment, it might be a good idea to try and get into theatres and try and see some of these procedures, just so that you have a better understanding of these procedures, particularly in OSCEs when you may have to explain a surgical procedure to a patient. So appendicectomies are very, very common in general surgeries, and that's for appendicitis. Colectomies, and that's normally done for colorectal cancers, inflammatory bowel disease, and diverticulitis. Cholecystectomies, another very common surgical procedure, and that's for managing cholecystitis or cholangitis. Incision and drainage of abscesses, and hemorrhoidectomies for hemorrhoids. Now, there are, of course, more general surgical procedures, but these are just a few of the most common ones that occur in hospital that you might like to go into theatres to either observe or even assist. Alright, well, thank you so much for watching. Now, if you do like this video, please do like, share and subscribe. We'll be posting every Tuesdays and Thursdays. And if there are any other topics that you'd like us to cover, please do comment below. Hope you have a great day and see you in the next video.